My name is Todd Nicholson, and this presentation is on regulatory, patient safety, and quality in healthcare. This is legal and ethical essentials in healthcare administration. This is EDN 812, Module 7 for July 1st, 2018. So what is regulatory, patient safety, and quality in healthcare? Those are the parameters by which healthcare must follow to keep patients safe, follow legal and policies and regulations that are put out by the federal government and state agencies. But it's also to make sure that you don't violate a patient's rights while taking them and having them in your healthcare facility. So this is my agenda. We're going to talk about regulatory. This is the laws that govern healthcare. We're going to talk about accreditation, the different accreditation um, organizations that are out there. We're going to talk about compliance, and we're going to talk about patient safety, and we're going to talk about quality. And then I'm going to give a brief summary. I will also mention my references at the end of the presentation. So regulatory, what is regulatory? Regulatory are those laws that require healthcare to follow. In 2010, we saw the introduction of the Patient Protection and Affordable Care Act, commonly referred to as Obamacare. I reviewed this on the Center for Medicare and Medicaid Services website, and it was published in 2010. But it's not only about the patient protection and healthcare being affordable, it's about protecting children and family. The Child Health Insurance Program does just that. This was taken from a Medicaid website published in 2017. But these are not the only two. You also have the Emergency Medical Treatment and Active Labor Act, or EMTALA. A lot of people hear the word EMTALA, they don't really know what it means. It means if somebody is in active medical treatment or a patient is in active labor, you can't ship them off to another facility until you've stabilized them and prepared them properly for travel over to the next location. The Stark Law. While this seems to be a no-brainer, the Stark Law was put into effect so you as a healthcare provider couldn't refer a patient to a relative. So I can't send a patient to my uncle who is a pediatric cardiologist. That would be illegal under the Stark Law. The anti-kickback statute talks about receiving money from medical insurance companies or medical equipment companies. So you use their product or refer them to that insurance type. We actually had a case like this at a location where I was stationed down in El Paso, Texas, where the equipment company was owned by the spouse of the surgeon who predominantly used their parts in his surgical procedures. A little bit later, they were both arrested by the Federal Bureau of Investigation and punished under law. The Health Information Technology for Economy and Clinical Health Act, or HITECH, goes along with the Health Insurance Portability and Accountability Act, so you can protect health information, especially the systems, from being hacked or the information being vulnerable to the outside. And then, of course, the Genetic Information Non-Discrimination Act 2008, another very important regulatory law that healthcare must follow. Accreditation. Now, accreditation really comes down to three organizations in the United States. The Det Norsk Veritas Healthcare Organization, and they have their authority from CMS in about 2008. It was one of the organizations that was started kind of as an answer to the Joint Commission that at one time, JACO, the Joint Accreditation for Healthcare Organizations, was considered to be too harsh. And DNV came out to be the kinder, more gentler organization. And then we have the Healthcare Facilities Accreditation Program, or the HFAP. Again, they deem their authority through CMS, and they're not-for-profit organization, and they're dedicated to helping healthcare organizations maintain the highest standard of patient care and compliance with the ever-changing rules in government. And this was provided by Meldy, Rhodes, and Gippy. And then, of course, the effervescent Joint Commission out of Chicago. They've been around for a long time, changing their name from Joint Commission on the Accreditation of Healthcare Organizations to the Joint Commission made it seemingly simpler and more streamlined. But they are a very large organization. They accredit nearly 5,000 hospitals in the country and another 10,000 other types of healthcare organizations like skilled nursing, rehab, long-term acute care, long-term care, and organizations like that. So the Joint Commission is everywhere. And these are the three primary accreditation organizations in the United States. Compliance. Compliance is one of those things where we need to make sure that not only are we following the rules and the regulations and the laws, but we're also complying with different things. So like the Agency for Healthcare Research and Quality, and they're making sure that the research and quality provided to healthcare patients in the organization follow a strict, rigid standards. The Joint Commission annually publishes national patient safety goals. These are identified from the surveys over the years where patient safety issues have arisen, and these are the goals for that year. The Joint Commission, if you have a complaint, they have a complaint process. You also file your sentinel events, those major events that cause an adverse reaction to a patient. You also do this through the Joint Commission. And then the last one I kind of want to touch on is the Emergency Care Research Institute, or the ECRI. ECRI is one of those organizations that makes sure that equipment and institutional research is up to date. So when I visit the healthcare organizations here in my jurisdiction, I hear them talk about the ECRI report and recalls. So they're taking a look at equipment that needs to be serviced because it has a low tolerance to stay in compliance with the standard. So this is some of the compliance organizations that you see. Patient safety. So I've kind of touched on only 5 patient safety issues because these are the 5 that I felt were very important. Shortage of nursing, so nursing staff issues that you have instead of a manageable ratios for span of control. Now you're getting out of tolerance where it's like 1 nurse to 10 patients. The other one is healthcare associated infections or hospital acquired infections. This is where the hospital infection control measures are not quite up to standard and they get an infection. Staph, MRSA are a couple of the infections that come to mind at this time. Falls. We talk about falls all the time. That's why we have timeout procedures and we do team steps to go through proper procedures so a patient doesn't fall. Medication errors. We've seen articles where nurses have given the wrong medication because they misread or they didn't pay attention or they lack of sleep. Medication errors is another one. And then patient engagement. Becker 2014 says patients are becoming more customer oriented and less a patient. So we need to be paying more attention to what the patient says. Quality. Now here I kind of focus down into my jurisdiction. So we have for quality, the Healthcare Quality and Compliance Organization, and they do all of the compliance within Southern Nevada. And they go on and they make sure that the hospitals are complying. The State Division of Public and Behavioral Health. The health district, so the hospital acquired or the healthcare associated infections are all reported to the health district, and we monitor and we send out disease surveillance individuals to investigate how that happened. We also have informatics, so we're tracking all that data across Southern Nevada. And then we also have the Southern Nevada Health Public Health Lab system where we can test for diseases, one of them being Ebola, but that still needs a confirmatory test down by the CDC. And then we have our state Medicare and Medicaid services, making sure that we're compliant with all the CMS rules. Health and Human Services at the state level, and then the Division of Public Protective Services that's taking care of the families. So in this presentation, I've talked about regulatory requirements, who the accreditation organizations are, compliance, patient safety, and quality. So these are my references: Becker's Clinical Leadership in Infection Control 2014, the 10 top patient safety issues for 2015, Child Health Insurance Program, retrieved from Medicaid.gov. Hofstra Law gave me the 5 healthcare laws protecting patient rights. Meldy, Rhodes, Gippy talked about the big 3, a side-by-side matrix comparing hospital accrediting agencies. Then the rules and guidelines. The Patient Protection and Affordable Care Act was retrieved from the regulation and guidance website. And then finally our textbook, PostGuard GD, Legal and Ethical Essentials of Healthcare Administration, 2nd edition. This concludes my presentation. Thank you.